Welcome, friends. Revise with me homeopathic remedy Magnesia phosphorica. Its common name is phosphate of magnesia and it belongs to mineral kingdom and its formula is MgHPO4 7H2O. This remedy was proved by Dr. W. H. Schussler. Here we are dealing with part 1 PQR review and the text is being taken up from Allen's keynote, and this is a very good revision for BHMS students, interns, house physicians and professionals at large. I am Dr. VK Chauhan, homeopathic physician. So let us go ahead. We are going to have the text from this particular book. Its front page is showing keynotes and characteristics with comparison of some of the leading remedies of Materia Medica by H.C. Allen. And if you open up this book, you will come across this particular text. And interestingly, this is the total text which has been given in Allen's keynote. Now, if you try to understand from where this note has come or text has come, you will find it is based on Hering's guiding symptoms. And it is given in running text. But in Hering's guiding symptom, there are 48 chapters are there, or sections are there, or headings are there, under which this drug has been discussed, and it has been using 4 grades to represent each symptom. However, if you see, there are no grades are given here in Allen's keynote. So each sentence is going to represent a PQR to us, or a peculiar, cure, and rare symptom to us, or a red line symptom to us. Now, the only drawback we find here in this work is that this text is disorganized in sequence and continuity. And this Magnesia Phos total text we find incorporates 15 PQRs, or 15 sentences are there, or 15 ideas are there. This total text represents here. So let us go to the first sentence. PQR1 is best adapted to thin, emaciated persons of highly nervous organization, dark complexion. The very first thing he introduces with the opening line, Allen introduces to the Constitution, are the client characteristic who is Magnesia Phos. Magnesia Phos is the patient who is thin, emaciated person having dark complexion. It is the somatic component or physical component, and its psychic component he tells highly nervous organization means he is nervous anxious person. So this small line gives us the constitutional characteristics of Magnesia Phos. Let us go to the second PQR. Affections of right side of the body. Head, ear, face, chest, ovary, sciatic nerve, and right-sided affections you will also find in belladonna, bryonia, chelidonium, calicarb, lycopodium, and podophyllum. So this symptom PQR2 is physical general having side affinity of Magnesia Phos. Now let us go to the third PQR. It is about the pain. And pain, what kind of pain is there? Sharp, cutting, stabbing, shooting, stitching, lightning like, in coming and going fast, like belladonna, intermittent, paroxysm, coming almost, becoming almost unbearable, driving patient to frenzy. As the pain comes, it reaches its peak within minutes, and it becomes so unbearable that patient is very much restless. Rapidly changing place. Now this intermittent pain, lightning like pain, which is a neuralgic pain, is going to shift rapidly. So there appears to be no organic pathology. No organic pathology like in teeth, if there is a pain, so there is no cavity. There is no inflammation like pulpitis. There is no inflammation like gingivitis. That's why this pain can shift very rapidly, and it can only be possible if it is a neuralgic pain. Now, shifting pain are seen in Lacan and pulsatilla also. If the pain has concomitantly constricting sensation, please think about cactus, iodium, and sulfur. Now, we have the cramping pain in neuralgic affections of stomach, abdomen, and pelvis. So what he is talking about is he is talking about the hollow viscera. In abdomen we have stomach, small intestine, we have colon, then we have common bile duct, we have cystic duct, we have ureters coming from the kidney going to bladder, and in pelvis you will find there is bladder and there is uterus. These all are hollow viscera and they have involuntary muscles in them. So the involuntary muscles, when they contract, they cause cramping pain. Or hollow muscles, when they contract, they cause colicky pain. This colicky pain is a specialty of Magnesia phos. PQR4 tells us about great dread of cold air, of uncovering, of touching affected part, of cold bathing or washing, of moving. So there are so many components which are going to aggravate. The patient is afraid of cold air because he knows that it is going to create a problem. It aggravates the problem. So what are the problems? How they are aggravated? Exposure to cold. If the patient uncovers, if you touch the patient, the affected part, if it is touched, lightly touched, then it will be unbearable, hypersensitive reaction to the patient. But if you press it hard, probably you will find that there will be a relief. Then cold bathing, cold washing, and even moving the part is going to bring about the aggravation. So it is a not only thermal affinity but aggravating factor are present here with PQR4. PQR5 tells us about languid, tired, exhausted, unable to sit up. The patient is exhausted. So these people who are having highly nervous kind of a emotional state and their autonomic nervous system is at the high tone, they get exhausted very easily. If they get exhausted, they are reaching to a neurasthenic state where their nervous exhaustion is tremendous and they feel exhausted, tired, and they even find difficulty in sitting up. PQR6 tells us about complaints from standing in cold water or working in cold clay. So here we have similar remedy calcarea and it is a ailments from exposure to cold. We go to PQR7 ailments of teeth in children, spasm during dentition, no fever. If the fever is there and head is hot, skin is hot, believe me, we have to go for belladonna. But if there is no fever and during dentition, the age and phase you will find here children. But what dentitional stage, dentitional period of life, they are approximately 6, 7, 8 months old. So they are infants. Generally, in infantile period, you will find this is the best suited medicine, McFoss. And let us go to the next. We go to the next is headache. PQR8 is headache. Begins in occiput and extends overhead like sanguinaria and silesia. So here the author tells us about the location and radiation. Then he tells us about the client of schoolgirls. Who is the client? young children's, schoolgirls, females are much more predisposed. Then associated with this headache, you have face red and flushed. So they are plethoric, flushed face. And aggravation or complaints are brought on by, initiated by, excited by mental or emotional stress, exertion or hard study. So physical exertion as well as mental exertion or emotional disturbances all can precipitate the headache. Now we have time modality. Aggravation 10 to 11 a.m. or 4 to 5 p.m. and the patient has better by pressure and external heat. The pressure is heart pressure. So this headache, which is a particular general, a clinical symptom has been given, and this symptom is a complete which has got location, extension, radiation, you can say, the client characteristics and associate facial flushing, causation and time modalities and emulation. We go to PQR9, neuralgia of face. Now, neuralgia of face, we have the face, we have two kind of nerves. Face is supplied, one is the motor nerve, seventh cranial nerve, and we have fifth cranial nerve, the trigeminal nerve. Trigeminal nerve is sensory. So he says facial neuralgia, so trigeminal neuralgia. Supraorbital, it is a branch of first division of trigeminal nerve, that is ophthalmic division, and or infraorbital. So infraorbital nerve is a branch of maxillary division of trigeminal nerve. Trigeminal has got three branches: ophthalmic branch, maxillary branch, and mandibular branch. So he is not telling us about the mandibular branch. He is telling specifically supraorbital nerve and infraorbital nerve. So in the distribution of, you can say, the ophthalmic division or in maxillary division will have pain. On which side? On right side. What is the character of pain? Intermittent. Comes and goes, comes and goes. And what is the character of pain? Again, darting, cutting. And what is the aggravation? By touch, cold air, pressure. Sometimes you touch the face and pain starts. Sometimes patient eating something, pain starts. Sometimes patient goes out and he is exposed to cold air. Patient has got sudden onset of pain which is unbearable. And this pain is better by external heat. That is the complete neurological symptom manifestation for MACPHOS. Friends, we go to PQR10. Here we have the toothache, which is worse at night, which is rapidly shifting, which is worse by eating, drinking, especially cold things, and better by heat. So this is a neuralgia. This is not a pain in the teeth because of caries or gingivitis or pulpitis. This pathology is a functional pathology and neurological pathology, and it becomes worse eating, drinking that initiates the attack, especially cold drinks. And better by heat is a good modality of the magnesia phos. If you have better by cold, we have the remedies bryonia, coffea, ferrum phos. We go to PQR11, spasm or cramps of stomach. With clean tongue, as if band was drawn tightly around the body. So it is a cramping pain in the upper part of abdomen, which is stomach, and this is a visceral pain. Now we go to PQR12, colic. Colic is also the visceral pain, hollow viscera like stomach, like intestine, like large intestine, like we have urinary tract, we have the ureters, hollow tubes, we have common bile duct, we have cystic duct, we have hepatic duct, and then we have uterus, we have bladder in pelvis. All these organs have the pain which is we call colic. So this colic can be flatulent colic, which is generally seen in young children's, And high flatulent diet is like milk and more of carbohydrates. If they are taken, they are going to cause flatus formation, fermentation in the intestines, and there can be colic. This sort of flatulent colic or distension and pain is possibly seen in adults in irritable bowel syndrome. This is colic predominant irritable bowel syndrome. Okay, forcing patient to bend double, that is how the patient gets relief better by heat, rubbing and heart pressure. You will have some more remedies for such symptom like colocin and plumbum metallicum. Then it is a veterinary application of the remedy of horses and cows. When the colocin fails to relieve, then magnesia phos comes. So it is a colic remedy. Friends, let us go to the PQR 13 menses. It is dealing with female genitals. Menses are early, flow, dark, stringy. That is, early means polymenorrhea, frequent menstruation. Flow is dark and stringy. That is how the discharge is. There is a pain which is worse before and which is better when flow begins, like in lechosis and syncum. So this is dysmenorrhea, and this is qualifies for secondary dysmenorrhea. Primary dysmenorrhea is with the onset of menses, the pain is there. There is a spasmodic pain with the prostaglandin which is secreted, which causes constriction. But here it is a congestive pain. The pelvic viscera are congested before the onset of menses. So before menses there is a pain and it is relieved when the flow begins. The pains, the character of pains is darting like lightning and shooting. It is worse on the right side and better by heat and bending double. There is one additional symptom which is vaginismus. Vaginismus is a very sensitive vagina, and it goes into the spasm which is going to cause a tremendous violent pain. PQR 14 tells us enuresis nocturnal from nervous irritation. So kids, magnesia phos kids who are neurotic or who have highly sensitive nervous system, they can have nocturnal enuresis. And here most of the time the urine is pale and copious. Pale and copious urine is quite possibly seen if you are drinking a lot of water, or sometimes you have to rule out the possibility of diabetes mellitus also. After catheterization, if there is a enuresis, probably you are have with catheterization there is a irritation to the urethra, or and there is a kind of a secondary infection because of catheterization. And common situation where we go for catheterization is in adults, like prostatic BHP, where there is a prostatic enlargement, benign prostatic enlargement is there, and patient is not been able to pass urine, there is retention of urine, or there is a stricture. So catheterization is been done to dilate that particular stricture part. So we find now the next important symptom is cramps, PQR 15. Cramps of extremities. Cramps of extremities, a very common symptom. Everybody has it. Generally, people who overexert in their day-to-day activity, probably they will have cramps. Or there is a restless leg syndrome. They have cramps at the night. Or sometimes there can be a patient who have got certain conditions like diabetes or peripheral neuropathy, or there can be vitamin B complex, or even vitamin D deficiency and mineral deficiency like calcium deficiency can also present with cramps. In pregnancy, if you have cramps, please think about the lady is having fluid expansion in the body. There is a fluid retention because of hormonal cause. They can also cause this kind of a pain. But don't forget that if the lady is not getting enough kind of minerals and vitamins, she can have the pain because of calcium deficiency also. Now this cramp can be in writers, piano or violin players. So we call it occupational cramps, and occupational cramps where these writers, pianists and players, violin players, they are using the intrinsic muscles, small muscles, lumbricals, uh, in profound precision and repeatedly. So these muscles go into the spasm and they get exhausted and they cause pain. That is writer's cramps or occupational cramps are there. So this is a very good remedy for occupational cramps. So friends, we go to the relationship now. We have to compare the medicine belladonna, colophyllum, colocynth, lycopodium, lacan and pulsatilla. Chamomilla is vegetable analog. Please remember, sometimes McPhos acts best when given in hot water. This is a posological part. For aggravation, we will find cold air, draft of cold air or cold wind. Cold bathing, cold washing, motion and touch. Touch, remember, fine touch. Light touch. Emulsion is by bending double, heat and warmth, pressure. And if it is burning pains, they are better by heat. Please remember arsenic. Let us also recall one fact that magnesia phos is having every kind of pain, but it lacks the burning pains. So, friends, thank you very much for watching and for your patient listening. Sharing is caring.